I've seen people get that diagnosis, which can be life-saving in the moment, but can lead to chronic illness when they go to the ER with this fever and these symptoms and they get diagnosed and treated. But then the symptoms continue. They may not have the fever and they may be trying to get back to work, like maybe still missing work, but trying to function in life, still having these symptoms and these bizarre, palpitations or chest pain or night sweats, those kinds of things. So with more treatment, we can really eradicate that.
Hi, and welcome to the Lyme Bites podcast, where we shine a light on the misunderstood science of Lyme and other vector-borne diseases, as well as the truths that many still miss. I'm Dr. Mariah Hinchy, naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs. I specialize in treating chronic Lyme disease as well as other complex inflammatory conditions. In this podcast, we break down what's working and what's not. We share the facts that most people miss, we challenge outdated thinking, and we give both patients and practitioners the tools to heal smarter. So let's get into it and change the way we heal Lyme. Welcome to another episode of the Lyme Bites podcast, rebuilding immunity, reducing inflammation, and redefining recovery. I'm your host, Dr. Mariah Hinchy, naturopathic physician, founder of Tau Vitality and Lyme Core Botanicals. If you've been following the Lyme disease conversation for any length of time, you've probably heard plenty about Borrelia. But today we're diving into another organism that can be just as devastating, and in many cases, even more difficult to recognize and successfully treat. The organism is Babesia, and the condition it causes is babesiosis. Babesiosis is an emerging tick-borne disease that's becoming increasingly common, yet it remains underdiagnosed and frequently misunderstood by healthcare practitioners. Because it's a parasite, not a bacterium, it behaves very differently from Lyme disease, requiring a completely different diagnostic and treatment approach. Joining me today is one of the leading experts in this field, Dr. Alexis Chesney. We will discuss everything clinicians and patients need to know about Babesia, from diagnosis and pharmaceutical treatment to evidence-based botanical medicine, as well as persistent infection, biofilms, and what true recovery looks like. Dr. Chesney is a naturopathic physician as well. She's also a licensed acupuncturist, ILADS fellow, author, and educator specializing in Lyme disease, babesiosis, and mold-related illness, as well as mast cell activation syndrome, dysautonomia, and other complex chronic illnesses. She's dedicated her career to helping patients with persistent tick-borne disease through an evidence-informed integrative approach that thoughtfully combines conventional medicine with botanical therapies. Welcome, Dr. Chesney. Thanks so much for joining us again.
Thank you, Dr. Hinchy. It's so great to be with you again.
So let's dive in. Tell our listeners what exactly Babesia is and why clinicians should be paying more attention to this organism.
Yeah, so I'm sure your audience knows a lot about Lyme and tick-borne disease. Mainly Lyme disease, though, is what's talked about. So I think it's really great to have the opportunity to be here to shed some light upon babesiosis because, like you said, Babesia, that could be Babesia microti, Duncani, Odocolii is now a newer species we're learning about. These are the pathogens that cause babesiosis, and they are parasites, not bacterium. So that means a lot of different things, different symptoms, different tests are needed, and different treatments, therefore, right? So your typical treatments will not work. Although, which is nice, there is some overlap, as you know, with herbal medicine between Lyme and babesiosis. But if we know that it's there, we really want to target specific treatments to get to it.
So for our listeners, let's make it clear. So Borrelia is a bacteria. So antibiotics are what you would need to be able to effectively treat it. Babesia is a parasite, so we need antiparasitics. And in the botanical world, as you just said, there's a lot of overlap, but if we're using pharmaceuticals, we definitely need to be using different classes of pharmaceutical antimicrobials to treat Babesia. So, in addition to that, how else would you say Babesia is different than Borrelia or some of the other bacterial co-infections?
Yeah, well, it hides in the red blood cell. So that's the nature of how it's parasitic. So then there's just a host of other things that we can think about. And that's where botanical medicine really comes in to think about, well, how do we protect our red blood cells from this invasion? So that's very different from, say, Borrelia or Bartonella.
So, how does it act besides living in the red blood cell? How does it act differently? And then clinically, what do you see differently with Babesia versus, say, Borrelia?
Yeah, so we'll see a different hallmark list of symptoms, most likely. While there can be some overlap, usually there are, the four symptoms that I talk about a lot and see a lot and ask my patients specifically if they don't report them just in case to make sure this isn't going on, or if it is, that we can identify Babesia. So those four symptoms can be night sweats, a shortness of breath without exertion, palpitations in the heart, and chest pain or pressure. So those are the big four. Now, also say headaches. That could be a pretty common symptom that people have. When we see more of a pressure headache, that is a little bit more pathognomonic for Babesia. So that makes me think of Babesia. These migratory joint pains, which we think more of Borrelia or Lyme. I don't see as much with Babesia, but we might see some muscle pain. But that usually isn't the top complaint, right? So it's really those four symptoms that I'm looking for. Not everybody has the four hallmark symptoms, but usually, one or two or three will tip it off because that makes it very different.
So, if you're seeing two, three, four of those symptoms, that would make you suspect that Babesia is there either alone or as a co infection.
Absolutely. And something like night sweats in a male, right? Very
Hmm.
unusual. Or a younger woman. Of course, then we need to think about for older women or middle aged women, there's menopause and, thinking through that. But sometimes in some of the patients, it's a hell. It's quite a tell for the night
Yeah. And
sweats.
especially for kids, too.
Yeah, of course.
Yeah.
Yeah.
So I am curious. This has happened to me a handful of times. I have gotten into a little tiff or a respectful discussion with another clinician who says, well, it can't be Babesia because Babesia causes anemia and this person isn't anemic.
Mm,
What would you say
mhm.
about that? Because we know it can cause it, but I know that, I have seen it, but chronic Babesia rarely, at least from what I see, causes like an acute anemic condition. I've seen ferritin really low, but not outright anemia.
Yeah, yeah, it does not always happen. Of course, it can. I see that more acutely because I do see acute babesia, but it doesn't always happen. But we see more of the lab changes early on. Those lab changes quiet down over time, and that first invasion and the reproduction and the load that we see, it might be easier to use some of the traditional tests, like a gem sustain to find Babesia, or, we might see the elevation of liver function enzymes, or we might see the change in H&H and the red blood cells going down and, all these changes that say anemia, right? But then later on, in chronic illness, we don't see that as much. Although I've definitely seen a low ferritin and even I've seen, yeah, anemia, but it's just less common for sure.
Yeah. So you touched about the differences between acute and chronic babesia. Would you like to elaborate? Because I would like our listeners to really understand the difference between the symptoms and lab values that you might see present in an acute case versus what the lab values and symptoms might be once someone is.
Absolutely, yeah. So acutely, usually people have a fever. They will have flu-like symptoms. Typical, like any of these tick-borne diseases, if and when you discover it acutely, there's usually that fever flu-like presentation. So that would be part of the acute phase. The changes on labs, like I mentioned, and then some of those hallmark symptoms are there for sure. We don't have to wait to see those. And then that gets confusing. Of course, if you have chest pain and palpitations, you need an EKG. We need to work that up. Is there something going on with the heart? So usually people go down that road, but they have the fever. So then they're going down the investigation of, well, is there an infection going on? And, sometimes those tests can pick up early Babesia if you're in a hospital setting or an urgent clinic setting that knows to test these things. So I have had patients certainly get diagnosed with Babesia early on in the acute phase with a fever at urgent only or the ER. So that's life saving really. So that was great. And of course they initiate some treatment, 7 days, and then they see me and we do more comprehensive treatment, longer treatment, make sure we really get rid of it. So yeah.
Yeah. And so, what is the acute treatment? 7 days of azithromycin with atovaquone? Is that what you're typically seeing?
Yes, that's what the, CDC IDSA recommends and what we see conventionally in the hospital setting or outpatient setting. But I of course will extend that. Yes.
Yeah. And so, what are the rates of persistence with Babesia?
Yeah, we definitely see that. Because of the way it hides in the red blood cell and because of biofilm, especially as well. And in some of the literature, they call it nests, but basically, just like Borrelia, Babesia also can create and hide in biofilm. So, because of these reasons, and others probably that we don't know yet, there can be this persistence. I see it all the time. I've seen people get that diagnosis, which can be life saving in the moment, but can lead to chronic illness when they go to the ER with this fever and these symptoms and they get diagnosed and treated. But then the symptoms continue. They may not have the fever and they may be trying to get back to work, like maybe still missing work, but trying to function in life, still having these symptoms and these bizarre, palpitations or chest pain or night sweats, those kinds of things. So with more treatment, we can really eradicate that.
So, what would you say is the biggest challenge or challenges in diagnosing Babesia?
Definitely the testing. Yes, yes. I mean, of course, we look at the clinical picture, right? It's not that we're treating labs, but it's helpful to get some reliable lab tests to point us in the right direction. And once we get past that acute phase, we really miss the sensitivity, the accuracy of these tests that are available commercially, conventionally, more readily, right? That your primary care might use typically. So the accuracy of those is no longer as high as it was in the acute phase. So I use FISH technology, fluorescent in situ hybridization. And so that is tagging basically the RNA of the Babesia, so this genetic material that it has, and they find it, lit up under the microscope. And that can tell us whether or not there is active Babesia even in the chronic phase. So the thing is, though, right, who knows about that? So not a lot of practitioners are using this test. So you cannot find it at a hospital lab or regular, Quest or LabCorp and these kinds of places. And usually, the typical primary care physician or practitioner is not going to know about that testing, unfortunately. Sometimes they do, which is great. And you can definitely seek out somebody who is educated in that way.
So, for our listeners who might be interested, IGenix, I would imagine, is the company that
That's who
you're
I use.
typically
Yes,
using
yes.
to do the fish.
Yep.
And then, how useful is combining an immunoblot with the fish for Babesia? Are you ready to transform the way you diagnose and treat complex chronic inflammatory illness? Because what if everything you've been taught to treat separately is actually deeply connected? At the Limebite Symposium, we're bringing it all together. Join us November 13th and 14th at the Fort Lauderdale Pompano Beach Resort in Florida, or attend virtually from anywhere for the premier functional medicine conference on complex chronic illness. This year, we're diving deep into the interconnected drivers of chronic disease, including neuroinflammation, immune dysregulation, COVID spike protein related pathology, mold and mycotoxin illness, breast implant illness, PANS pandas, and of course, Lyme and other vector borne infections. Because the reality is, your patients don't have just one of these, they have several. And if you're not trained to recognize how these layers interact, you'll continue to miss the root cause. And if you're a patient still searching for answers, this is the information that your doctor may be missing. This is how we move from symptom management to true healing. So join us in Pompano Beach or from anywhere in the world. Don't get left behind. Register now at limebytes.com. That's LYMEBYTES.com.
That's an option as well. Absolutely. Yeah. IGeneX has the immunoblots now for Babesia. I think when I learned with Richarwitz, there wasn't the immunoblot, and the Babesia is 85% sensitive. So that's where we went. I just followed his his great training. But yes, you could certainly add an immunoblot for the Babesia onto that and see what you find. Yeah.
And then in addition, we can look at liver function tests, right? We can look at hemoglobin and hematocrit. We can look at other lab values that can be useful to certain labs that look at inflammation and immune function and things like that. Would you like to go over the list of supportive labs that you might look at to diagnose Babesia, whether it's acute or chronic?
Yeah, like a CBC, which is just looking at a complete blood count, right? So that's red blood cells, white blood cells, platelets. So looking at that, and then CMP, if we're getting technical, complete metabolic panel. So that's looking at liver and kidney function. More so for the liver function, electrolytes. Electrolytes can change acutely, but not so much chronically, I don't see. And the Babesia fish is where I would go for that, for the specialized technology that IGeneX has. And then, yeah, CRP, sed rate. We don't always see those, but usually I would include those in what we're looking for. And then an iron, iron panel, basically total iron, TIBC, and ferritin, see where that's at. And then always looking at, the picture, if it's more of like a fatigue picture, we might look into vitamin B12 and folate and vitamin D and thyroid panel. And, we can go on here
Yeah.
working this up, right?
Yeah.
But yeah, I think that covers probably the basics for when someone presents. And I have actually seen it's interesting. Someone's coming to mind, that was referred to me with this mysterious anemia, right? And she had some of the Babesia symptoms, and she was worked up for GI bleed, everything, right? Like where is this anemia coming from? And it was a chronic picture of anemia. Yeah, it can happen.
So, share with us the pharmaceutical treatment options and when you choose one regime over another, and then we'll talk about the botanicals and integration.
Sure. Yeah. So there are a couple of options there. I like to use atovaquone and azithromycin. So atovaquone you take twice a day with a fatty meal, and azithromycin is just once a day. You do need to avoid CoQ10 because of the mechanism of atovaquone. It disrupts the electron transport chain in the mitochondria and the parasites, but also ours. So we don't want to help that along and cause trouble there. Let that work. So I always have to check. You always need to check, even those multivitamins. I mean, CoQ10 is great, but we
Mhm.
have to really make sure there's no CoQ10 going on for that. So yeah, so I'll start with 30 days of that, and not just that, but I always add to it. But usually I do, and I do see a difference when we start using, like in the, whether, of course, if we're in the acute phase, but even if this is the first time somebody's had this diagnosis and the first time they're doing treatment, I think using pharmaceuticals in the beginning does make a big difference. And so that's my approach. That's what my experience. So we'll start with the 30 days, and we may transition after that. Depends on how they respond. And like I said, I'm not just using the pharmaceuticals in the beginning. We might add some herbals at that point. I definitely will add nystatin. I always use that if we use any antibiotics because of the antifungal nature of that medication. And that helps with just cutting down any fungal overgrowth. Because so the atovaquone is the anti-malarial. The azithromycin is an antibiotic. So it does have an antibacterial approach to it, but they see that it synergizes with the atovaquone. So sometimes that's a little confusing for people, but we need to take those together to get
Right.
to Babesia.
And we
So
had said in the beginning, like, we can't use antibiotics for parasites. And so not for people to be
yeah,
confused
yeah,
about that. Like
yeah.
azithromycin is definitely an antibiotic,
Uh-huh.
antimicrobial, but when combined with atovaquone is effective for Babesia. Now,
Exactly. Yes.
do you ever end up having to use tafenoquine?
Sometimes I do. I tend to wait on that, but yeah, I mean, a few years ago, coming out of Yale, it was tafenoquine and atovaquone. So you could use those together, and I've done that later on. But you could come out of the gate trying that. Yeah.
And are there any other pharmaceuticals that you like to use for Babesia?
So I was actually using more Primaquine. So that one is covered by insurance versus tafenoquine. I see people, that sometimes is a need, a request. So usually their atovaquone and azithromycin would be covered, and then we might use Primaquine. But tafenoquine is easier because it's once a week, but it's out of pocket from a compounding pharmacy. Primaquine is every day. But yeah, you could use Plaquenil. I've used that as a pharmaceutical option. The thing about using that is that if you use it with an antibiotic in combination, it will treat Lyme as well. So sometimes these protocols set us up to cover Lyme if that's in the picture as well. So with the atovaquone and azithromycin together, the azithromycin will get to the spirochete form of Lyme, and then if we just add something to make sure to get to the round form of Lyme, then we have a Babesia and Lyme protocol right there with, and I haven't said it yet, with the antibiofilm agent, of course, which could be in herbs, or we could use serrapeptase, nattokinase, lumbrokinase, one of these, always on an empty stomach for those. Yeah. So can get creative and, combine different medications and natural therapies to get to more than one pathogen if we need to, for sure.
Right. So, talk a little bit more about the biofilm since you brought it up. For our listeners that don't know, what is it? And does the biofilm for Babesia differ from that of Borrelia?
Yeah. So, one other thing, just probiotics. Can't forget that. So, in case
Yes.
people are piecing together
Yeah.
these protocols, do not forget the probiotics if you're using the azithromycin because of that effect it does have on the gut. We don't need them for everything, like atovaquone proguanil, just to kind of go back to the other options for anti-Babesia medications. That's easier in some ways because it's a pill, and the atovaquone proguanil together makes it effective for Babesia, and then there's not that antibacterial antibiotic effect. But it's a lot easier than taking that yellow paint, which is the what people call the
Pretty nasty
atovaquone.
stuff.
Yeah, yeah. So just to also mention that, and yeah, making sure to protect the gut as much as we can if we're using the antibiotics. So yeah, so moving on to biofilm. So yeah, I mean, I'll use the same treatments for each of these pathogens, but I'd love to know if you have a different approach.
No, I don't. I mean, when I'm looking at biofilm, usually all of my patients I have on the G3M. And so the G3M helps to break down the galactin 3 component of the biofilm. And then, typically they're on like nattokinase, especially if there's a spike protein issue. Sometimes I will use lumbrokinase and then using Chinese skullcap pretty much with every single patient. And Chinese skullcap does have some effectiveness against the biofilm. And then I'll typically use grapefruit seed extract because of its antifungal properties, but also a study that showed that it agitated the round body or the cyst form, but also has some effectiveness at breaking down the biofilm too. So usually I have, I would say at least three different botanicals on board for the biofilm. And I know that Dr. Horowitz loves using the combination of the essential oils specifically, right? I think he uses, is it cinnamon, clove, and
Oregano.
oil of oregano?
Mm-hmm,
Yeah.
mm-hmm.
Yeah. So there's
Yeah,
a
the
lot
Johns
of
Hopkins
options.
studies there. Absolutely, a lot of options. Yeah, and like you're saying, it can cover, multiple mechanisms or goals with sometimes one or two or three different items, so that you're
Which is
covering
great.
different. Yeah, yeah, it's awesome. Yeah.
So, in addition to biofilm, what other roles do botanical medicine play in your treatment approach?
Yeah. So, I mean, absolutely killing off Babesia, also protecting the red blood cells, bringing
So
down
be
inflammation.
specific. Talk to us about which herb you're talking about.
Yeah, yeah. Well, what is it? The Artemisia annua and
Mhm.
bidens has that CDK inhibitor function where it basically just protects that. They're called like hemoprotectants and all these different words about, protecting your red blood cells, your hemoglobin in the red blood cells, and therefore your oxygen, right? Because that's a whole nother story with dapsone that we didn't talk about. But
We can talk about it in a
we
minute.
can get back to dapsone. So I sometimes you can use these herbs, thinking about that part too with dapsone. But yes. So going back to protecting the red blood cells and endothelium. Yeah, I mean, there's just a wealth of amazing properties that these herbs have, so opposed to using atovaquone and azithromycin, which might work pretty well at killing off not the bacteria, the parasite, using these herbs provides so many supportive properties. So my favorites would be cryptolepis, right, with the cryptolepine, and that's an alkaloid that has more of that killing property, but also brings down inflammation. And then there's the Seta acuta bidens, like I mentioned. We might use some alcornia, Baikal skullcap, and Japanese knotweed. So those are often the core herbs at all. And I'm curious, I know you use a lot of these herbs too. So to hear your favorites in Babesia will be interesting. But that'll be a core set of verbs to start to get to all these different pieces of what's going on with thinking about Babesia and its effect on the immune system, the red blood cells, your blood vessels, in addition to the killing properties.
Yeah. Yeah. So, I mean, those are my core herbs as well. I think most of those are the ones too that were studied by Fang in 2020 and showed to be effective against Babesia. And I believe the study was Babesia duncani, which is supposed to be the harder one to eradicate. So, yeah, like I use Japanese knotweed to protect the endothelial cells. I use Seta to protect the red blood cell, the liver, and the spleen. Typically, like my anti-parasitics would be the sweet Annie, cryptolepis, black walnut, and then I use Alcornia as well, Chinese skullcap to help to block the inflammatory cytokine cascade, along with Japanese knotweed. And like you said, cryptolepis has anti-inflammatory properties too. And then using some sort of like proteolytic enzyme and the G3M pectosol to break down the biofilm. And then I'm always using a variety of different genus and species probiotics just to, help to rebuild the microbiome. Everyone knows I'm, crazy almost about like rebuilding the immune system, resetting the immune system. And, we can't do that without a healthy microbiome. And, because of our food, because of toxins, because of everything that we're exposed to, whether we're on pharmaceutical antibiotics or not, I feel like we're just chipping away at that, since from the moment that we're born. So always doing things in lifestyle modification, like I know you do with your patients, talking about, detoxing and removing toxins from the internal and external environment, as well as, cleaning up diet and trying to eat, polyphenol rich foods and enough protein and, all of the things that we look at as naturopathic physicians. Are you suffering from Lyme disease or another complex chronic illness and aren't sure who to trust when it comes to herbal supplements? Hi, I'm Dr. Mariah Hinchy, founder of LymeCore Botanicals. As a naturopathic physician specializing in complex chronic infection-driven illnesses like Lyme disease, I needed herbal medicine I could truly trust. That's why I formulated LymeCore Botanicals, where our herbal tinctures are handcrafted in small batches right here in Connecticut. We use the whole herb, never isolates, to preserve the full spectrum of medicinal compounds. Every single step from sourcing to extraction is done with precision to ensure maximum purity, potency, and consistency. These are the same herbal formulas I use to heal myself and have used for years to help my patients and family members heal too. And now I'm making them available to practitioners and patients everywhere. LymeCore Botanicals, herbal medicine you can trust from a doctor who lives this work. Learn more at LymeCore Botanicals. That's LYMECORE.com.
Yeah, yeah. I mean, those things, yeah, I was built like per person, like thinking about what they need and all those different puzzle pieces, putting those together. Sometimes I have people come, a lot of my patients are pretty well educated, pretty healthy otherwise. Not everybody, but I have to say I have a really wonderful bunch that I work with, and they'll be already doing a lot of diet change or just live that way, with really low carb, high protein, organic foods, no packaged foods, this kind of thing, right?
Yeah.
So for those people, we don't have to make as much change, right? But then sometimes we get the soda drinkers and the
Yeah.
The pizza lovers, and I mean, here and there, who doesn't enjoy that? But yeah, sometimes we need to do a lot of work because that inflammation, whatever we can control, if we can control not adding sugar and inflammation to fuel the fire of these pathogens, that's great. That's something within our control, right? So
Right.
so yeah, definitely that's a huge part, and detox, absolutely. I don't know if we want to get into that, but that's like a whole topic unto itself. Depending on the person, maybe acutely, a little detox is certainly going to be helpful, but more so with chronic disease, chronic infections, the detox component I see is so important. Really, really important.
Yeah, absolutely. It
Absolutely.
definitely helps to mitigate herxing, when you're supporting the detoxification pathways and elimination out of the body. So, talk to our listeners about integrating pharmaceuticals with these various botanicals. How do you do it? And how often do you do it?
Yeah. So, like I was saying in the beginning, I recommend using those pharmaceuticals. So, maybe we'd start with a tovacone azithromycin, or maybe we'd start with malorone, which is the tovacone progonil, and then add it to something else if there's another pathogen involved or whatnot. And then we'll go from there. So, in the beginning, again, if somebody presents, very ill, I will want to bring in a lot of supportive therapies, right? So that detox piece is going to come on board. So things like, herbs like milk thistle and burdock and Berber panella from Nutrametrics that I love, that people love, et cetera, et cetera. That piece, lymph, thinking about the lymph, thinking about sweating, because we have all these different detox organs. It's not just the liver, but I do pay a lot of attention to the liver. And water, right? The kidneys. So drinking enough water to flush out, which I used to be so dehydrated when I think about it. Like I did not drink much water till
Yeah.
whenever I realized, that's a good idea. So I see a lot of dehydrated patients, I think. So really just boosting that water. In the beginning, just boosting that water and taking out sugar, that can make such a huge difference, right? But yeah, so we'll think about, okay, detox component, what other supports do we need? Maybe adrenal support. If somebody's really stressed, if they're really tired, maybe we need some sleep support. Really just going back to the basics, right? Food, sleep, stress. So, they may not be sleeping very well or very long or long enough. And that affects our immune system hugely, right? So coming back to all those supports that are so important for healing. What else? Sometimes we'll, think about mitochondrial support at some point, not with not with the tofocone, but later on with CoQ10 and NADH and these other cofactors of the electron transport chain in the mitochondria. So yeah, so kind of like seeing, what are the person's symptoms, the severity, the impact it's had on their life, what is their lifestyle, their diet like, stress, all of that. And really building an individualized plan for them. So usually when we get into the chronic piece, then yeah, this is what we're going to be talking about. We're going to be creating more of a lengthy plan, even though it's lengthy enough with the acute first month plan in and of itself. But and also meeting people where they're at. So some people really want to get into all of that and want that help and can do that for themselves. And sometimes we just have to, start small, talk about it, revisit it, if they're not getting better, really look at the whole picture and put things together.
So, when someone is in a chronic or persistent infection, does your advice remain the same to start out with the pharmaceuticals and do an integrative approach? Or do you treat it with botanicals alone if it's in this chronic state?
If they've never had antibiotics or antimalarials, I will start there usually. Then I do see a lot of sensitive patients, right? So interestingly, sometimes the most sensitive patients do better with pharmaceuticals.
Yeah.
But anyway, again, everyone is unique. So we just see, like, we hear about their past experiences with anything that they have taken. And, if it's a sensitivity issue, then herbs can be a lot easier in the beginning because we could do really low doses. But otherwise, I tend to do the max dose if the person can handle that, right out of the gate. But yes, if people are sensitive or they have mast cell activations that are, these reasons, different reasons that they may be sensitive, then we need to, pick and choose what we're using a little better. And really go with the low and slow approach. But otherwise, yeah, I will start with pharmaceuticals and then move into natural therapies. And then I tend to rotate a lot. I mean, sometimes we'll use pharmaceuticals longer and rotate through different protocols, or sometimes we'll just rotate through different herbal protocols. I do, yeah, I'll use different companies and their preparations. So like a lot of what we're talking about is probably based in Stephen Buhner's work with herbs. I'll also use other protocols like Nutrimetics or Beyond Balance or Byron White formulas. And I really see that, I think part of the approach of changing it up over time, getting to the pathogens in a different way. Also, some of them have some homeopathic qualities, which is interesting. A little mysterious, but I think there's something to it. So kind of getting to them in these different ways, and even on an energetic plane can make a difference. And kind of on that note, I've had a lot of patients use biomagnetism, and I think rotating through that type of therapy can be very, very effective too. So I like that we have a lot of tools, and I think it's great that we can rotate through a lot of them depending on the person's sensitivities or tolerance and such. And then eventually, so I don't start right in with dapsone or tefenaquine, but then I'll kind of revisit that idea later. So if we've done a lot with natural therapies, then we might come back to saying, do we want to do something like dapsone or primaquine typically? And then we can think about that. Methylene blue too, although that might be a little earlier on. Again, it depends. Like there are certain tests, you need to do just to make sure that somebody can tolerate some of these. Actually, also, so methylene blue, dapsone, and primaquine or tefenaquine, you need to get G6PD tested. The other thing with methylene blue would be if somebody's on SSRIs or certain medications, you can't take that. So there are always these multiple factors that we're, thinking about and paying attention to, whether someone's a candidate for something, right? But then later on, I might use the dapsone or the primaquine. I have not had anyone have a mutation with that G6PD. So just being cautious, obviously, to
Can you
test that.
explain to our listeners what that is for those that don't know?
Right, right. So these drugs can create, well, for dapsone anyway, it creates a hemolytic anemia, basically using the drug. Will do that. It's a side effect. Not very pleasant. Absolutely. That's why I wait on that one. But if you don't have G6PD, if you don't have enough of it, like if there's a deficiency, it will be really dangerous to take that drug and have that effect on your red blood cells. And so you need that enzyme for one of the processes. I forget in the red blood cells
I don't
to
remember either.
keep your hemoglobin working for you.
Right. And so super important, by the way, if anyone is considering doing dapsone therapy, that you're taking methyl donors. Like you need to be on methylfolate.
Oh yeah, high
Methylene
dose
blue is helpful to take because you don't want to end up with meth hemoglobin. What is it, Alexis?
methemoglobinemia.
Thank you.
Yep,
I can
yep,
picture it, stumbled over
yep.
it. But yeah, it's a very real thing. And if you're not taking the right things along with dapsone, it actually can occur very frequently. I've actually had a handful of patients who have come to me who had ended up in the hospital because they
Mm,
weren't doing the dapsone protocol appropriately. So it wasn't just dapsone, it was that they weren't the practitioner that had them on it was not following
mm,
the dapsone protocol because there is a protocol, right? It's not just here, take the dapsone, right?
no,
So,
no, that's
for-
yeah, it's scary. Yeah,
yeah.
because you have to be very careful.
Yes. So for anyone listening who is doing it or considering doing it, make sure that you're doing it with a provider that has been adequately trained so that you don't end up with any of these very serious side effects.
And there's the battery of tests that you have to go through. So you do reticulocytes. You can measure methemoglobin while you're taking dapsone. You start slow, of course, low dose, build up slowly, but you're getting these blood tests every 1 to 2 weeks. But there's a lot that can happen within a week, right? So, so I see, which has been a game changer, having people have a pulse ox. So they keep that, they check their saturation, their oxygen saturation, at least once a day. I'd say it's so easy. Do it twice a day. I mean, you don't have to do it all day long. Then we get people who are like constantly on it, like once or twice a day and then leave it alone. And if you get below 92%, that's a concern. If you get below 90%, go to the ER. I've never had that happen, which has been great because someone might check, it might, see, normally what are we at? We're at like 99% for most people, maybe
Right.
98%. That's
Yep.
common, right? If we're otherwise healthier. So I have people get a baseline, say they're at 99. Now they're on dapsone, the first week goes down to 97. All right, that's fine. They're feeling all right.
Yep.
They have to look for side effects. That's the other thing, of course. But the side effects, right? Fatigue. They have fatigue anyway. Like, how do we know? Is it a Herx or is this a side effect? So that's why I think the pulse ox is so amazing. I mean, by the time you get blue lips and hands, this is an ER situation. So, and telling patients to look for that doesn't always go over that well. So if we have a pulse ox to kind of like get in between those events, I've seen that really helps. Yeah.
Well, and another symptom too, right, would be like feeling tipsy,
Yeah,
dizzy,
dizziness,
shortness
lightheadedness.
of breath. But it's like,
Right,
wait, these
right.
are all symptoms of Babesia to begin with.
Exactly.
Yeah.
So it's really helped differentiate and make me, because I mean, I'm responsible for this treatment and I do not want people to get into that situation, but also I want the patient to, be comfortable with this little bit of an aggressive, different type of approach,
Right.
So they do, they feel very much in control when they have that pulse ox. And not everybody gets to the high dose. I mean, for me, I know maybe I have a different population than Rich Horowitz, but rarely do people get to that top dose or his, double dapsone 200 twice a day. But even 100 twice a day can be hard to get to. But usually people get to, 50 twice a day, something like that. And, it's effective, right? So we can use this as a tool. It doesn't mean that we have to go, go to like 93% oxygenation and push the reticulus. We don't have to make it crazy and stressful and just over the top in that way. I think it's still effective. I see Herx's. And for all of my people who have done dapsone, they have felt much, much better afterwards. So it's been very, very interesting. It's a great tool, But again, not everybody's a candidate, and that's just how it is.
So, largely speaking, with an acute case, what do you typically see for treatment time?
With an acute case,
Acute. Yes.
I mean, 3 months,
Okay.
could be 4 months, could be longer, but
Yep.
I'd say on
And
average 3 months.
and then for a chronic case, what would you say your average treatment time is?
Yeah. Well, that all depends on when did it start, right? Which
Yeah.
sometimes we have no idea.
Right.
And
Right.
sometimes
Well,
it's
and what
40
other
years ago.
co-infections are present, right, and all of that. But,
Yeah.
like, if we're just talking Babesia.
I mean, if we got it within 3 years, I think it's going to be, a much better outlook and a
Yeah.
shorter treatment, maybe, I don't know. Everyone's different. I don't like to like pin a number, but it could happen in 9 months or something, 6,
Yeah.
9, 12 months, right?
Yeah.
But a lot of times it could take longer because they may have had it for so long. And
Right.
then it's just harder to get that load down.
Yeah. No, I
Yeah.
just really wanted people to hear that, yes, like you could be looking at with Babesia alone 9 months, a year and a half, depending on how compliant you are,
Yeah.
how long you've been infected, if there's co-infections, BART, Borrelia, et cetera, if your gut is really jacked up, like all of these things really feed into, how long it takes to get it into remission. So I just want people
Yes.
to understand like this is not a short treatment, whether it's acute or chronic.
True, very true. Yeah, and I think some people are very surprised unless they know. Like I have a lot of patients who know somebody who has gone through this before. But if you really have no idea, then it is a shock. Yeah, to say, well, why aren't I better yet? And they're better. There's improvement over this time. But it can take a long period of time to completely recover. And then I always treat 2 months past the resolution of symptoms. And sometimes that's the hard part. People are like, what do you mean? I've done all this time. Like, I'm done. I want to
Yeah.
eat some ice cream and
Yeah. No,
I
you
want
don't.
to
Do
go
you want
out
to
to the
relapse?
bar
Like,
and
do you
like
want
be
to start
done.
over?
Yeah,
Yeah.
so sometimes that part is hard, like sticking with it for that 2 months, but I
Yeah.
really see that works. It's amazing. It's the
Yep.
calls I get 6 months later, from the people that will go through, say, "Okay, so did you do this part, this end part?" I think I stuck with it a week, but then, it was my birthday, and I know. And it's not like you're going back to 0. That's the other thing that happens. People get, really upset and discouraged. I mean, there can be so much discouragement, and it's not like you're going back to 0. I'd rather not have to restart treatment and would have rather just finish, but yes, we can pick it up again, and you can get better again, and you will, because we have that proof that you did. So, yeah.
So, how do you determine when someone's truly in remission?
Yeah, I mean, some of these complex cases are tough, right? But I'm always looking at my list of symptoms with the patient, and we're always going through tracking symptoms. I have patients do that on their own, bring that in. So if there are multiple infections, it's hard to kind of sometimes know, all right, this is Lyme, this is Babesia, but we do the best we can because they usually do have different pictures or what else might be going on. So we try and, for each pathogen, treat the 2 months past what seems like that pathogen picture, like if it's the night sweats and the chest pain and the pressure headache or whatever, once that resolves 2 months past that. And then we can retest. So, or if we tested, in the past and we had a positive fish test, we can then test that again, which is helpful. Some people, just compared to Lyme, there's a little more nuance there. So for the Babesia fish, I wait a month after somebody finishes treatment and then we retest. And yes, you can use that test over and over again, which is great because it tells us if the Babesia is active. Yeah.
So, if there's one message you want every clinician treating Lyme and or Babesia to understand about Babesia, what would it be?
Let's see. I mean, the first thing is just look for that hallmark pattern, right? I mean, I think a lot of medicine is pattern recognition, right? And there's a lot of overlaps between conditions, but if we get that pattern recognition radar out there, I think just identifying it, thinking about it, asking, because sometimes it's like mold, you know. If you have it on a questionnaire, people don't say that they have mold in their house. But if you ask them 3 questions, like, have you ever had a leak in the house? Any water damage? It's not just about smelling or seeing mold. You
Right.
have to ask all these. But anyway, so sometimes you really need to ask, right? And probe around a little bit. So even if it's
Absolutely.
on a questionnaire, I always ask because really it's Dr. Horowitz that sticks in my head, don't forget about Babesia. It was like, he says that back when I was just overwhelmed learning about Lyme. And I was like, okay, someday. But it's so true because if we're just focused on Lyme and not thinking about making sure there's not Babesia in the picture, they're not going to get better, right?
Right.
We want to make sure to catch it.
Right.
So yeah, I mean, I just think that, yeah, just those hallmark symptoms, just ask. Make sure to
Yep.
ask your patients and ask
Right.
them to track symptoms. Makes all the
Need to be
difference.
informed, need to, a funny thing is like I've had so many patients come in and they're like, "Well, I was tested for everything." Well, what do you mean everything? Everything. I was told I'm clean. I don't have anything. I have a perfect bill of health. And it's like you realize that there's about, 6,000 tests that you could order on somebody. Like, if you don't actually test for it and test for the different species, like you aren't going to find it. And if you don't know symptoms of it, like if it's not on your radar, then you're not being worked up for it. All right. So if anyone wants to come see you as a patient, how do they find you?
Yeah, so you can go to my website, dralexischesney.com. You can read different articles and you can schedule an appointment that way.
Wonderful. So thank you so much for being here with us. It's always a pleasure to have you on. And thank you for sharing with everybody.
Thank you. Yes, I hope clinicians working and patients, or lay people, anyone, is a little more educated and can bring up these questions if they're exhibiting these symptoms.
Great. So, to all of our listeners, thank you so much for joining us for another episode of the Lyme Bites podcast. If you enjoyed today's conversation, you won't want to miss Dr. Chesney's in-depth presentation at the 2026 Lyme Bites Symposium. She'll take an even deeper dive into the treatment of babesiosis, sharing the latest research, practical clinical pearls, and specific pharmaceutical and botanical treatment strategies. You can join us in person or virtually for her live presentation, November 13th and 14th. And if today's conversation helped you better understand babesiosis, or if you know someone living with a chronic mystery illness who may still be searching for answers, please share this episode. Every share helps us reach more patients, families, and clinicians who need this information. Until next time, keep asking questions, keep advocating for your health, and remember, together, we all heal stronger. See you next time.
If this episode gave you an answer, brought you new insight, or made you think differently, subscribe to the Lyme Bites podcast and share with someone who's ready to take control of their healing journey. And if you can, please leave a review. It helps others to find the show. Thanks for listening, and we'll see you next time.